over the next little while. So
I apologize. I just had an attack of vertigo and I didn't get things together. So I don't have a formal introduction for Wayne, but Wayne's been in CCL for a long time. He leads a chapter where he is in some part of Atlanta, Georgia. And he worked with the Environmental Protection Agency and the PEHSU, the Pediatric Environmental Health Specialty Unit, that's for Southeastern United States for many years. He's retired from both now, and like a lot of us, kind of does more or less full-time advocacy, but he still has a lot of knowledge about the inner workings of the EPA and lots of other things. So we thought he'd been interesting to have him speak to us.
Okay, well, I'm still involved with the PEHSU as a volunteer. So while I'm retired from EPA, I'm still very actively engaged with the Southeast PEHSU. Okay, again, I appreciate the opportunity to provide a brief overview of EPA's regulatory process, EPA's Children's Environmental Health Program, and the Pediatric Environmental Health Specialty Units. Again, I'm used to using acronyms, so I'll try to be careful, but to begin with, when I mention PEHSU, I mean the Pediatric Environmental Health Specialty Unit. So I hope you can forgive me for that acronym. And let me just add to the introduction that Lori gave. I'm trained as an environmental engineer, worked with both wastewater and hazardous waste facilities before I got involved with children's environmental health. I enjoyed and appreciated the opportunity of working with multiple schools of public health and medicine, the cooperative extension programs throughout the Southeast, and an organization called the Agency for Toxic Substances and Disease Registry. I'm not sure if people know what that is. The acronym that I'm going to use, ATSDR, but basically they're connected with the CDC, and they do a lot of health assessments and deal with toxic issues. Anyway, I noticed that the invite to the presentation indicated I was going to give some insights inside the EPA information. So, so I thought I'd start with a short story that occurred a few months before I decided to retire. A 3-day CDC conference in Atlanta addressing climate change and public health was canceled in December 2016 without any explanation a few weeks prior to the conference. Thanks to Al Gore, the Carter Center, the American Public Health Association, and the Harvard Global Health Institute, the conference was moved from CDC to the Carter Center and put back on the menu minus the US government. Meanwhile, after complying with a new policy, which required us to notify the EPA Administrator's Office in Washington that of all meetings and conferences that we would have with outside parties, we were told that EPA personnel could not attend the conference. Jesus. Again, this stuff just blows my mind. I'm still kind of have a problem with it, but I just wanted to give you an appreciation of what life was like in the real world. Laura Turner Seidel from the Turner Foundation, one of the conference sponsors, got wind of what was going on and told me that they would comp the fees for any representative from EPA who wished to attend. A half a dozen of us attended on our own time. At the conference, Al Gore indicated that he had called Ted Turner, Jimmy Carter, and a few other contacts to ensure that this conference would happen. Again, it was reduced from 3-day to 1 day. We had all these international people from overseas that were invited, and with 2 weeks' notice, it was just ridiculous to cancel it. And during my 39 years at EPA, I had never really seen this type of direct interference with any CDC or EPA program. But again, the last administration, there was a lot of things we really didn't see. But I just, one of the reasons I pointed this out was to let you know that it was reassuring that the passion that people had to make these things work, people at fairly high levels. Jimmy Carter was also at the conference and actually spoke. And he wasn't originally on the agenda, but it was like I said, it was just something that gives you a little bit of the inside sense of why I chose to retire from EPA. Okay, next slide, please. Okay, I was asked to provide information on EPA's regulatory process, EPA's Children's Environmental Health Program, and hope that I can provide some ideas that may help support some of our joint efforts to address the climate crisis. It's important to know how the environmental criteria is established. It's also important to know who's engaged and involved in promoting and addressing these concerns on a national level. This presentation is also quite fitting at this time, as October is Children's Health Month, which is a designation that I instituted within EPA's Children's Environmental Health Program. EPA, like many other federal agencies, have 10 regional offices throughout the country. However, the largest office is in Washington, where they write the regulations and establish the program priorities. There are a significant number of resources, which include outreach materials, curriculums, pilot projects, and interventions, exceptional interventions that are available for use, virtually all for free. All you need to do is know who to contact in terms of some of these programs to get some of these resources, which I find to be quite helpful. And when I go through the presentation, I'll point out a couple. Next slide, please. Okay. In view of the recent decision by the Supreme Court restricting EPA's attempt to reduce greenhouse emissions from power plants via the Clean Power Plan, I think having a better understanding of EPA's regulatory process is helpful. A bill, when approved by Congress and signed by the President, becomes law. Congress has authorized the agencies, such as EPA, to create regulations to provide the details that make the laws work. Regulations are one of the EPA's most significant tools to protect the environment. Once the regulations are in effect, EPA works to help Americans comply with the law. Many of these responsibilities are later delegated to the state. And as I go through these presentations, if there's anything you want to add or any questions, feel free to raise your hand or interrupt me. I'm quite flexible. Next page, please. Okay, before EPA can officially publish a rule, the agency must submit significant rules to the White House Office of Information and Regulatory Affairs for review. Reginfo.gov includes a regulatory review dashboards that allows people to sort the rules by agency, stage of rulemaking, economic significance, and international impacts. After the White House completes the review and if it allows the agency to continue with the rulemaking, EPA will publish the proposed rules in the Federal Register, which provides the public with an opportunity to submit comments. In developing these proposed rules, a lot of times they may hire consultants and involve additional efforts or people from other regions that have expertise in these areas. The proposed rules and supporting documents can be found on EPA's official docket in regulations.gov. This website is the primary comment platform and serves as a clearinghouse for materials related to EPA rulemaking. Once EPA has reviewed comments on the rulemaking proposal, it revises the regulations and submits the rules to OMB for clearance prior to public release. I think typically they have if we don't hear from OMB within 7 to 10 days, we assume that's it, and we go out with the final rule. Most significant rules are challenged. If they are litigated, they can result in significant delays of months, years, or even decades. So regulations and actions through this process aren't necessarily the most expedient way of dealing with issues. A future administration can also modify or rescind the final rules as long as the agency justifies the change and the new rule is consistent with the authorizing statutory language. Court's decision also drives regulations, or in many cases, revisions to regulations. A lot of times we try other ways other than the regulations to make things happen. Try to get industries to voluntarily comply, agree to do certain things voluntarily. in order to short circuit this process. But 9 times out of 10, the rulemaking process is the way we go. Next slide, please. Any questions on the regulations? And again, I just gave you a real short overview. We've got thick books. They get very, very complicated, very, very detailed. When I was working with the hazardous waste program, a lot of times I felt sorry for industry because of the level of detail they needed to go to in terms of having a good understanding of what was going on in terms of the regs. It's very, it's a lot of material. And there's reasons for it. Again, we regulate hazardous waste because of past abuses.
What is OMB?
OMB, I'm sorry, Office of Management and Budget.
Office of Budget Management.
Yeah, excuse my lingo. For me, it's
So
Hey,
Wayne,
Rick?
can you hear me? Wayne,
One-
can
one
you hear
more.
me?
yes.
So when it goes to OMB, do they put a financial cost in the bill and the rulemaking?
The rulemaking all contains that. And all that information is done in the proposal.
Okay, and so then and maybe you're going to get into this, but there's been some arguments over the last couple of years, and the regulations are supposed to be not cost prohibitive or something like that. Is that?
Well, I think virtually every rule that is implemented, they try to they do a cost analysis. They look at the cost of the rule versus the benefits. One of the concerns that we had with the Clean Power rule was that the criteria for doing the analysis was changed by the last administration, which kind of threw off the analysis. But again, a detailed economic analysis is shown where the benefits, when they look at health and all the costs associated with the benefits of the rule versus the implementation of the rule, shows that there's not only normally a net benefit, but normally it's several orders of magnitude in terms of the benefits. Lori, I think you're muted.
One more. So when it goes to Congress, what are their options about the rules when they see them?
Okay, typically the rules, Congress passes a law, and the regulatory agencies generally, try to figure out how to spell out how the laws will be implemented through the regulations. Now, Congress can always, I think they have a period of time where they can overrule the regulation. If I'm not, if I recall, the Clean Power rule was actually was overruled by Congress, but at the time it was not signed, and the president at the time, Obama, didn't agree, and that's as far as it went. But again, it was challenged. The Supreme Court stayed the rule until it eventually died for a variety of reasons. And
Right. So in
we'll
those,
get into that later.
so in those 60 days with Congress, they could choose to overrule a rule if they wanted to.
I believe so. I'm not sure. When it goes to OMB for 10 days, that's part of the process in terms of Congress getting involved in terms of looking at a rule. That is very unusual. I'm not aware of any rule that EPA issued except the Clean Power Plant where Congress actually went in and voted against it. It may have happened, but I'm not aware of it. But there is a provision where Congress has that authority. Congress has the authority, but it has to be approved by the president, and that didn't happen. Okay, next slide, please. Let me get into the Children's Health Program at EPA. EPA's mission is basically protection of human health and the environment. Now, the agency makes policy decisions based on the best science available. And historically, that was based on studies that were done on a 150-pound white male. We understand that what happens to the 150-pound male is not equivalent to what happens to a 30-pound child, let alone to an infant. EPA established a new policy to consider the risks of infants and children as part of risk assessments generated during its decision-making process. The Children's Health Program reviews new proposed regulations to make sure this actually happens. Next slide, please. This is one of my favorite slides in that it gives a good depiction of different threats that children are exposed to. Some of the most significant environmental hazards include UV rays from suns, indoor and outdoor pollution, pesticides, radon, secondhand tobacco smoke, and specific compounds such as mercury and lead. And again, these hazards lead to respiratory diseases, developmental disorders, cancer. And some of these diseases, such as childhood lead poisoning and asthma, are much higher in minority inner city areas. Next slide. The Children's Health Protection Advisory Council is a body of external researchers, educators, healthcare providers, environmentalists, state and tribal government employees, and members of the public who advise EPA on regulations, research, and communications related to children's health. The members serve voluntarily, and they generally meet 2 or 3 times a year to provide specific recommendations to EPA, generally via a letter directly to the EPA administrator. In preparing this presentation, I was pleased to see that our Lori is currently serving on the CPAC. And input through this advisory committee is an important way to influence policy. And in that Lori's involved, we definitely have a direct connection. Lori, I don't know if you want to share any of your experiences or any thoughts that you had dealing with the CPAC.
Not at this point. Move on. Thanks.
Okay, next slide, please. The Children's Environmental Health Program also addresses climate change due to the significant impacts to children. We deal with exposures to higher level of ozones and particulate matters can result in more school absences, emergency room visits, hospital admissions of children for respiratory and asthma related illnesses. As the climate changes, we're seeing longer pollen seasons and the introduction of new pollens in some regions of the country. Increasing wet weather and increased humidity creates an environment that promotes the growth of mold and mildew. Climate change increases the number and intensity of hot days, hot nights, and heat waves in the United States. Also, there's a broader distribution of pests and increased growth of weeds that lead to greater pesticide use, putting children at greater risk of exposure to these harmful pesticides. Next slide, please. For those of you that are, I guess, pediatricians, you're probably familiar with the Red Book that's put out by the American Academy of Pediatrics. That's a handbook, I think, that pediatricians use as a guide to deal with childhood diseases. EPA's Children's Health Program suggested and supported the development through the American Academy of Pediatrics of the Handbook of Pediatric Environmental Health, which we refer to as the Green Book. And the goals is to provide a concise clinical guide to the recognition, management, and prevention of childhood diseases associated with environmental hazards. And there's specific chapters on climate change and the health effects of children, dealing with infectious diseases, air pollution, thermal stress, mitigation and adaptation strategies. Something I thought was really interesting, the specific suggestions about what health professionals can do in their practice in terms of providing education dealing with children climate change issues. And a whole slew of additional resources. They also talk about extreme weather impacts. So it's a very comprehensive book. I think Ruth Exel was the primary author, and I think they're coming out with a 4th edition. Every edition gets a little bit thicker. Next slide, please. EPA has developed educational materials and literature addressing climate change. This is an example of a curriculum that I helped pilot test for upper elementary and middle school students. It's called Recipes for the Healthy Kids in a Healthy Environment. Next slide. There's a specific chapter on climate change, and it's something that it's something that I really enjoyed working with, and the students really enjoy interacting with. It's very interactive. Let me just give you an example. It's a lot of engagement with the kids. I might ask for 3 or 4 volunteers. 3 of them hold hands and act as the sun. The 4th would act as the earth. And I would ask them, how does the earth go around the sun? And then you would talk about the seasons and day and night have to turn. And I mean, it's very engaging. This is all available for free. It's all downloadable of the internet. They have posters, and it's and like I said, I think and also they have a take-home section at the very end where they actually take home and talk about what they've learned, with their parents. And again, it's something that I highly recommend, and I've really enjoyed using it. And like I said, the students have really enjoyed. And again, you can make it, like I said, age appropriate. But like I said, I would suggest upper elementary or maybe lower middle school, even though I was kind of tempted to use it with my granddaughter's kindergarten class. But you might find this interesting. The teacher basically felt that discussions on climate change might be a little too traumatic for kids at that age. Okay, the next slide. And again, to get those, there's a whole slew of resources, including this that you can find at epa.gov/children. Okay, next I wanted to talk a little bit about the pediatric environmental specialty units. Unless any more questions on children's health, we do a lot more. I was just trying to target it specifically to what is, how it impacts how dealing with climate change type issues. Okay, the pediatric environmental health specialty units are a nationwide network of experts in the prevention, diagnosis, and management and treatment of health issues that arise from environmental exposures from preconception through adolescence. There's generally one pediatric environmental health specialty unit in each of the EPA regions. They don't get a lot of money, but they do a lot of really good things. They get on the average maybe $150,000 a year. EPA jointly funds it with ATSDR, but considering the level of expertise and involvement and engagement, it's we really get a lot of big bang for our buck. And I could go through a few examples about how the PEHSU has been used. But basically, they seek to increase the knowledge and awareness of children's environmental health among health professionals by educating physicians during grand rounds, by conducting conference and seminars that provide training to current health professionals. They also help prepare for the next generation of health professionals dealing with environmental children's health. Next, please. And the next slide was just basically to show where these centers are located. So the one in Atlanta is at Emory University, the one in Boston's at Harvard, New York City's at Mount Sinai. Again, and they're top pediatricians associated with each of these. Normally, they try to get a pediatric toxicologist, a pulmonary specialist, let's see, someone dealing with developmental disorders, but it's generally, like I said, I've been very, very pleased with the level of expertise and contributions. They generally meet once a year at a national conference we had in Chicago about 2 or 3 weeks ago. Let's go next slide, please. Okay, why is it important? The PEHSUs work to strengthen pediatric environmental medicine and public health prevention capacity through consultation, education, outreach, and referrals. We've generally gone to these meetings where they do a lot of research, and they also help with the translation from research to practice when it comes to environmental health to children. They indicated that most health professionals don't receive training on how to prevent, recognize, manage, and treat environmental related conditions. The Institute of Medicine reported that only 6 hours of training in pediatric environmental health is provided for most physicians. The PEHSUs are a resource for health professionals for consultation, education, and training. They have an 800 number to call, and their advice is free. PEHSUs also partner with the local state, health, and federal agencies and nonprofit professional organizations in carrying out their work. Let me just give you a couple of ways we've actually used the PEHSU. We had a de-icing fluid on airplanes at the Atlanta airport. Apparently was leaked and released into the downstream waters. There were a number of people that are pregnant women that were concerned about the potential impacts. Well, we could have sent a toxicologist. Having pediatricians with expertise in this area were better received and was a lot more effective, and was a lot more effective in terms of soothing the concerns of the people that drank the water that was contaminated. Okay, next, please. One of the other things that the PEHSU have is a role in disasters. Right after Katrina, I got a call from the director of the Emory PEHSU, who basically says, "What can we do to help?" So I went to our emergency response people, and they said, well, at that time, well, they put me on this call with the people that were responding. And they said, well, at that time, I really wasn't able to make such any offer because they said they were basically just people were shooting guns all over the place. So and they were picking up bodies. So that was what they were immediately dealing with. But what they wound up doing in this particular area was developed a fact sheet saying when children could return to areas that were impacted by hurricanes and storms. I don't know whether you remember, but at that time, the mayor of the area was basically of New Orleans was telling people to come back. The area was not suitable for kids to return to. So it's basically having this type of fact sheet, which we distributed to all the medical professionals in the area, was a good resource. But again, I think the PEHSUs have not really gotten as much as they should have, done as much as they should have in terms of being well known, in terms of outreach, where people aren't that familiar with that resource. And that's been one of my big pushes, or at least while I was working at EPA. Do what you can to make sure the overall community is aware of you. They publish, books, and a lot of times they write articles in newspapers. Again, generally the go-to source. After 9/11, they were contacted in terms of what's the concerns dealing with air pollution. It was actually interesting. EPA was saying the concerns weren't that major. The PEHSUs weren't saying the same thing. And as it turned out, the PEHSU was correct. And they also are doing a lot of work on wildfires when there was a lot of wildfire activity in the West. Next slide. This gives you a picture of a fact sheet that was developed addressing wildfires. Again, what they did was pull together an interagency group from a variety of different sources to develop and this wildfire guide for public officials. They also developed fact sheets on lead, drinking water, pesticide exposure, let's see, mold, mildew. So it's and all these resources are available on their website. PEHSU also developed in well, there's different work groups and meetings. They developed a lot of pamphlets and brochures. Right now, they're working on information dealing with face mask use and also the use of disinfectants associated with the COVID situation we're dealing with. Next slide, please. The New England PEHSU recently developed a climate prescription to facilitate climate-related guidelines and discussion in clinical practice. The highlights of the climate-related link provide guidance and directions to community resources. They're currently working on a Spanish version, and again, it's provided as a resource for climate and clinical care in collaboration with the regional EPA office. So it's like that's just another resource. Next slide, please. This is a poster that was used, or slide that was used when we, next slide. The Region 3 PEHSU partnered with the Physicians for Social Responsibility to host a community meeting of community organizers and state and federal agencies, educators, healthcare providers to begin networking for climate action. And here's a visual image from the keynote speaker where she talks about how when you deal about climate change, you need to involve all parts of the community, that they should all be part of the process, specifically reaching out, I think, to environmental justice groups. Next, please. Again, the PEHSUs are delegated to increase knowledge about environmental medicine among healthcare providers regarding children's environmental health. Many of the environmental risks that lead to ill health can be lessened or prevented with proper healthcare provider education and preparation, and that healthcare providers are well positioned to deliver care and health education needed to protect children from environmental threats and to share that information with colleagues. This is a resource on their website where they have webinars, online courses, as well as an extensive resource catalog. Next slide, please. Okay, well, again, this pretty much ends it in terms of what I wanted to, the highlights. And again, like I said, the PEHSU is an excellent resource. It's available. And having this level of expertise available to help address issues and concerns, I think is very helpful. They're actually dealing with prescriptions for the public, not only for climate change, but for other issues associated with healthy housing and schools and daycares and things like that. So I don't know if you have any additional questions, but this pretty much covers the topics that I was asked to address in a very quick and brief manner. So hopefully learn a little something. And you know, one of the things I used to give out when I used to do outreach or meet with healthcare providers, we give them copies of the Green Book. So that's it's a good resource. It's something that I found to be very helpful. And if you're a pediatrician, I would strongly suggest you acquire a copy through the American Academy of Pediatrics, or perhaps through your local PEHSU.
Wayne, thank you for an excellent talk and coverage of things that many may not know about. I'll weigh in because as Lori and Marion know, they got funding from the regional PEHSU here in Montana to promote using the EPA flag program in schools and other sites, which was especially aimed at tribal and rural schools in Montana. So a very on the ground practical thing that leads to more discussions of air quality and climate change. So And we can open it up to questions. Folks can just unmute themselves with this smaller group if you have questions for Wayne at this point.
Questions or comments?
I have a question for Wayne. This is Jones. I want to know if I could get your email, because I was looking at jobs in Georgia. I found a job that was doing water treatment, where they take water samples and they test it. And I wanted to talk to you about that. Do you have an email I can
Sure.
email you at?
Wayne Garf, Garf, at AOL.com. I have to switch over to Gmail, but it's taken a while.
Okay, can you repeat that?
Wayne, WAYNE, GARF, at AOL.com.
Okay.
Also, if you want to email anybody at EPA, it's an easy way of getting to them. Their last name dot first name at EPA.gov.
Okay.
We'll do the PEHSU one first.
So did PEHSU get involved with the lead problem in Flint?
I'm not really sure. That's another region. I dealt a lot with the EPA person in Region 5 that dealt with it. What I found to be interesting was that I think it was primarily EPA. I don't think the PEHSU really got heavily involved, to my knowledge. But what I found interesting, I was looking at CDC's reports in terms of water quality, looking at reports throughout the Southeast. And I saw that there were a lot of communities where the levels of lead in drinking water were as high or higher than were in Flint, Michigan. Again, when you measure the levels of lead in water, you do it at the tap. And what happened in Flint was that the new water source was more acidic and caused the lead from the service connections to go into the drinking water. So it's an issue. In fact, one of the things Region 4 PEHSU does is they have this project called Break the Cycle, where they have different classes and students, graduate students, generally give a presentation on environmental concern that affects environmental justice community. And one of the things they pointed out was that there's a lot of areas in, well, they did North Carolina, where they get well water, and the well, which is not regulated. Well water goes through the piping, whether it be the pumps or the water system in the house, and the lead that's leached out is a lot of times very troubling. And when you start dealing with really any lead is a problem. But while most of the concern with lead is associated with lead-based paint, having lead in drinking water is not a good idea.
Thanks.
So Marion Cummer was able to present at the most recent PEHSU meeting in Chicago. She was virtual about the FLAG program in Montana.
So you were also at the PEHSU meeting?
Well, we listened in the car.
Wayne, because Yvonne Collins is a obstetrician, what kind of work is done related to obstetrics and fetal medicine within the PEHSUs, if you have a idea?
Well, it's interesting. They just wound up getting into, well, I think it was about 3-4 years ago, they decided that they needed to get more into dealing with pregnancies and concerns associated with that. Again, one of the slides something that I used in the past shows the developing stages of the fetus. And it's interesting that depending on the exposure, depending on what stage is development, the impacts on the developing fetus can be very difficult, very different. I know they do education, they do outreach, they do consultations, and I think each PEHSU now has someone with this level of expertise on their staff. I know they're concerned about food, diet. I know there was some concerns with arsenic in some baby foods, and there's a lot of stuff out there that needs to be addressed. And I'm, off the top of my head, I can't think of any publications specifically dealing with this, but I'm sure they have some.
Catherine?
I just wanted to ask you mentioned that in the process of rulemaking, and I think even before it gets to the Office of Management and Budget, there is a delineation of both the costs and the benefits of a given proposed rule. Am I right?
That's correct.
So I assume the costs are done in dollars. Are the benefits given in dollars?
Yes.
So
Yes.
there could be some rules, I'm hoping most, that have a net negative value, that there's greater dollar benefit than there is dollar cost to a
I
rule.
think virtually all rules that are passed, that are considered, have a much greater benefits versus cost.
Then, and does that, both the benefits and the costs go to Congress, or does Congress only see the costs? I don't understand why they don't just pass all the rules, and allocate money to all the rules immediately when they see that it's a net savings.
Well, again, for Congress first passed the laws, and after the law is passed, EPA develops the regulations, and in developing the regulations in terms of how it's implemented, they actually get dollars and cents. And again, the way they actually have some of the benefits are sometimes hard to actually put a number on. You have these people that have that expertise, but how do you value someone's health? Look at maybe the cost of hospitalization, cost of medicine, but I'm not sure exactly what goes into it. But there's a protocol that they use that's consistent. I think that economists use when they're able to put a dollar and cent figure on things that are sometimes a little hard to actually put a finger on.
Okay, well then my question applies to the laws as presented to to Congress. When does a given law show both the dollar costs and the dollar benefits of a given environmental law?
Not to my knowledge.
I see. Okay,
Congress
thank you.
could pass a law basically saying, you can't. There's no dollar and cent figure put into it.
But when they're studying bills in Congress, I mean, lots of times the I guess the GAO usually,
Congressional Budget Office.
Oh, yeah.
the Congressional Budget Office puts out things. So like when there's been carbon pricing issues come up, the Congressional Budget
It's
Office
usually
will
costs.
look at the costs.
Yeah, I think you're right, Lori. Yeah.
And that information is presented at the same time as pushing the bill to get passed?
I'm not
I don't know if
sure
you-
how
yeah.
it works. I mean,
Yeah, I think it has to be requested. I don't know if Lee or somebody else might have a little more knowledge of that, but I think that's requested by members of Congress.
Yeah, I thought the Government Accounting Office analyzed the dollar involvement of every proposed bill even before it was allowed to go to the floor. Am I wrong? I'm just asking this because I think the money is one of the main things that keeps a lot of environmental bills from passing, and I just want to make sure that the right costs or the right benefits are represented.
Well, I know that happens in our state. They have to have a fiscal note on each bill,
Fiscal note.
but I don't know about nationally.
Yeah,
Yeah, you see that in California. I don't know what the national policy is. It does seem as if there was some every time we heard about a bill, it had to go to the Congressional Budget Office for some reason, but exactly what they do and how that shows up, I really don't know. And I
Yeah,
don't know whether it's associated with every bill or, there's some, it makes sense, but I don't know.
I mean, another factor that goes into that of some of these bills, particularly the ones relative to EPA or at least air quality, is the social cost of carbon, which is a debatable issue. I mean, it's a huge issue, but that's the number that is used for a lot of laws.
Right.
And as many remember, in previous administrations, it was put at an absurdly low amount. In the current administration, it's come up some, but is still much lower than most people figure or think it should be to represent the true costs of air pollution and others. So
Right.
that's a huge issue because that's what goes into a lot of regulations and others is the social cost of carbon.
Thanks.
I just stuck, I'm just putting a couple things in the chat just to some opportunities. One is that the EPA just came out with another big batch of clean school bus funding in the last couple of weeks. It's a good opportunity to talk to the press in your community or your state. I actually got interviewed on a TV channel about it a couple of weeks ago. It's a good thing to write an op-ed about, or like I said, write an article or get interviewed about. And then the other two things are still open when I checked them a couple moments ago. So the Enbridge pipeline sign on for healthcare professionals, there's a sign on for individuals or organizations. And then the healthy climate prescription is something that's happening before the COP27, which is coming up in just a couple weeks. And it's, again, there's something for individuals and for organizations. They plan on presenting that to some of the people at the COP. Not quite sure how it works. To answer. Yvonne, sorry, I'm on my coming over and stealing my husband's computer, but I'll check on those references. If that's not a complete link, I will send them to you.
Yeah, I just got an error message on the second link, the Google Doc, saying that this, I can't remember what it said. I can open it up again.
Okay.
Saying, sorry, unable to open the file at this time. For the
Okay.
middle.
I'll check on it and send it to you guys.
Okay, thanks.
Any other news, updates, ideas in your areas?
Don't get us started.
Yes, stunned silence.
In 8 minutes or less.
Yeah.
And
Don't
remaining
forget to
a little
vote.
bit upbeat.
I think one of the big things that I've been thinking about with other people preliminarily is understanding how the IRA programs affect or relate to local programs and how to sort through for a given business or person or entity what might be available. So if anybody has any information on that, I'm looking for it. Is that coherent?
Yeah, I mean, we have a couple things so far, and it's concerning for states like ours that's conservative, because sort of like the Clean Power Plan, they can do a lot of things that aren't helpful to the climate with that money. So it is looking concerning, and there's a couple people that have already, it's a couple NGOs that have already written some reports. I'll stick them, I'll forward those to you guys too. But like Wayne described with a bill that's turned into law, there's still, the rulemaking is still happening. So
Right.
we're realistically looking sometime in 2023, hopefully, right, Wayne? Does that sound about right?
Yeah, I mean, my understanding, there's provisions of the Inflation Reduction Act that take an effect immediately.
Okay,
So it's, and it changes with time. In fact, when I actually, there's actually a website which when you put in specific information, we used it as part of our outreach program. It tells you what you're entitled to get. And one of the things that surprised me, that is if you make a modest income, you can get the federal government or rebates that cover the cost of converting your gas stove to electric. I mean, and it's basically, they pay 100% of the cost up to a certain amount. So there's a lot of stuff in there where, the message gets out to the right communities where people can get a lot of potential benefits. So that may be something that maybe we should spend a little more time getting a handle on.
And
I'll send the link to everyone that may be similar to what you were talking about for individuals. Oops.
Yeah.
Wrong.
Okay.
There we go.
thanks, Lee. The
I have one for cities, but I don't have a similar guide for business entities, which is what I'm working with right now.
well, good question, and certainly, hopefully, we'll get some more guidance on that. Or I think a lot of people are working that. Two other
And there
things.
was a CMA climate program, California Medical Association climate program last Friday that had a gentleman whose information I don't have, who works with the National Academy of Medicine Task Force and works with healthcare facilities, which is not what I'm looking for. But if anybody wants that, I'll put my email in here. If I can track him down and get his contact information, I will send it to you.
Okay, and likewise, we have a close friend who is a leader in the healthcare sustainability field, a national leader. So I'm sure is very much up on that. If people have interest, let us know, and can put you in contact too, Lee. To change the topic a little bit, or at least to let folks know, on Wednesday, the Lancet Countdown 2022 drops and goes public. There's the global one, and then there's also the Lancet Countdown US Brief, which is focused on, obviously, indicators in the US. It's worth reading. It's not revolutionary because it builds on huge amounts of data, but this one will be, I think, very good because of it is very prominent about recommendations relative to the IRA and environmental justice. So it's worth reading once it becomes available, and I think that's Wednesday for both of those.
can you find that invite and put it in the chat? And Rob was one of the authors or editors, reviewers
Yeah.
this year.
Thank you for doing that.
Yes, really.
It's wonderful.
The other thing, and again, also thinking climate, thinking very long term of something I had not thought of, but was brought to our attention. There is a real effort starting to make the next farm bill dramatically different. Transformating is the word that's been used because it's a huge bill, affects all impacts of agriculture, food security, and a variety of other programs. But for the past, and it's renewed every, I think, 5 years, but for the past several iterations, it has just been tweaks of what's already happening, a lot of which is not sustainable. So there is a grassroots and higher level effort now to start trying to get some changes in that will be substantive, rather than purely supportive of corporate initiatives, shall I say? So that may be something worth looking at, because that certainly affects all of us and all of our states, though it's a little outside of our maybe comfort zone in healthcare.
There is some money in the IRA for carbon farming issues too. Not a huge chunk of it, but. Well, maybe we will end 1
Yeah.
minute early tonight. We will keep our fingers crossed for the elections. Everybody keep doing your part.
All right.
Will
Thanks.
you guys send out an invite for the next meeting though?
Yes, it's always the fourth Monday at this time. And I am blanking on who the speaker is going to be next month. Yeah.
Okay, okay.
Thank you for attending, Joan.
Thank you for putting
Okay.
this together.
Yeah, thanks, Wayne, and thanks for making this happen, Lori and Rob.
Right. Stay
Bye.
safe, everybody.
Great presentation, Wayne.